Thank you, Dr. Stavia. Wow, c'était une introduction un peu qui met la pression.
Thank you, Doctor. Well, this introduction put some pressure on me. I'm most happy to be here. Like Dr. Stavia said, I worked for 2 years at Epicenter, and now that I'm gone, finally they invited me to make a presentation again. I'm most happy about that. I'll be speaking in English.
Donc, je vais présenter.
I didn't realize we could be speaking in French, but I'll present in English.
I'm going to present this study from the endTB observational study, which will talk about the treatment of children and adolescents with multidrug-resistant and rifampicin-resistant TB regimens containing bédaquiline and delamanid. So, until recently, the treatment of MDR and RRTB was long, toxic, and poorly effective. However, in 2015, 2 new drugs were available to treat MDR and RRTB, and these drugs are bedaquiline and delamanid. And the endTB project, which was launched in 2015, was launched and funded by Unitaid and had 5 main goals. And one of them was the observational study to document the expanded use of bedaquiline and delamanid in 17 countries. And one of the other goals was to implement clinical trials to find simpler, less toxic, and shorter regimens. And Mylène will talk about this after this presentation. So just to give a bit of background on the endTB observational study, if you need additional background, this was one of the largest multi-country prospective observational study at that time, where patients were treated for MDR-TB with bedaquiline and delamanid, as long with other drugs. So it was implemented in 17 countries with 3 different partners, including MSF, IRD, and Partner in Health. And it was funded by Unitaid. And the patients were included between April 2015 and September 2018. So as we have heard this morning, and again just before this presentation, children and adolescents with TB and also with MDR and RRTB are often underdiagnosed and undertreated. There are limited data that exist on the treatment of children and adolescents with bedaquiline and delamanid. And one of the main reasons for this is that because they are not enrolled in the clinical trials usually, and that is why the observational studies are essential. And with the endTB observational study, it gave us one unique opportunity to assess the effectiveness and the safety of MDR and RRTB regimens containing bedaquiline and delamanid among children and adolescents. So the population in this study consisted of children and adolescents of 19 years old and less who initiated MDR and RRTB long and individualized treatment regimens that contain bedaquiline or delamanid together with other drugs between 2015 and 2018. And in this presentation, I will first describe the cohort of included children, talk about the end of treatment outcomes, describe also a bit of the safety of these regimens, which consist of the frequency and the outcomes of the main adverse events of special interest. Those are predefined sets of adverse events and serious adverse events of interest that occurred at a clinically relevant severity level, such, for example, as acute renal failure, electrolyte depletion, hepatotoxicity, hearing loss, hypothyroidism, myelosuppression, optic neuritis, peripheral neuropathy, and QT prolongation. So one of the very important aspects of the endTB observational study is the unique safety monitoring data collection that was put in place. There was a systematic collection of the safety data, including the serious adverse events, the adverse events of special interest, and the adverse events of clinical significance. And in addition to that, all the serious adverse events were also reported to the national authorities and to the MSF pharmacovigilance unit that was built through the endTB project in Geneva. So this cohort consisted of 190 children and adolescents in 14 countries. Most of them were aged between 15 and 19 for about 87%. 64% of them were female. And as you can see in the bottom of this table, it was a quite sick cohort of patients, with half of them resistant to fluoroquinolone drugs. 71% of them have lung cavities or bilateral disease on the chest X-ray. And about 70% of them had history of treatment with second-line TB drugs. So that's a very sick cohort of MDR-TB patients, children. So at treatment start, all the children and adolescents received one of the two drugs of interest, bédaquiline or delamanid, or both bédaquiline and delamanid. So bédaquiline was prescribed in regimens in 51% of the children, and 39% of them received regimens containing bédaquiline, and 10% of the children and adolescents received a regimen containing both bédaquiline and delamanid. So as I said, this is a full regimen, so there are also other drugs prescribed with bédaquiline and delamanid. So in addition to these drugs, they receive another 5 drugs in median, and these are the most prescribed drugs in the MDR regimen. So the main prescribed drugs was linezolid for about 80% of the children and adolescents, followed by pyrazinamide, cycloserine, quinolones, and clofazimines for about 70%. And at the very bottom of this graph, you can see that still 35% of the children and adolescents received injectable drugs at that time, where they were still part of the standard of care. So I will present now about the end of treatment outcomes of this cohort. So there was a very high successful treatment outcome in this cohort. About 85% of the children were cured or completed treatment in a median time of 21 months. 13% of them experienced an unsuccessful treatment outcome, so 5% died, 4% were lost to follow-up, and 4% had also a treatment failure. And out of the 10 deaths that were reported in this cohort, 6 of them were due to TB, or TB was a contributing cause. So I will present now some of the safety results, and I will just present the main adverse events of special interest that occur in the treatment. So the first and the main adverse event that occur in these patients were peripheral neuropathy that occurred in 16% of the children and adolescents. And you can see on the pie chart, the yellow part is showing that in 54% of the case, the episodes resolved without sequelae, and for 35% of the case, the episodes resolved but with sequelae. Then it's followed by electrolyte depletion, which happened in 15% of the children. And as you can see, in most of the episodes resolved without sequelae at the time of the reporting. And the last one, the third one, which occurred in 7% of the children, was hearing loss, which are mainly due to the injectable drugs. And here we can see that only a third of these episodes resolved without sequelae, although another third resolved but with sequelae. And for 1 children, the episode was unresolved. And finally, since this was one of the main concerns at the time of these new drugs was prescribed, we can see that we had only 2 episodes of QT prolongation in this cohort of children and adolescents, so a relatively low number, which is about 1% of the cohort. And in these 2 episodes were resolved without sequelae. So what we can see from this study is that the treatment with MDR and our TB with bedaquiline and delamanid is effective and well tolerated among children and adolescents. The adverse events of special interest were not very common in this cohort, although there was one small limitation, is that the children under 5 were underrepresented here, and this is mainly due to the barriers to treatment decision, and including uncommon bacteriological confirmation for children and adolescents. And as I said before, there is very few data on the safety on children available, usually because they are not enrolled in the clinical trials. So that highlights again the importance of the endTB data in the endTB observational study, which was one of the first cohorts, actually the first cohort of children and adolescents receiving bedaquiline and delamanid as part of their regimen, with especially a very detailed follow-up and adverse event monitoring. So one last slide to say that all this data, mainly on safety, contributed to the updated WHO guideline in 2020 and 2022. And now the recommendation is that there is no barrier to use this drug in shorter regimens in children. The drugs are now recommended at all ages. There are existing child-friendly formulations, and there are no major safety issues. So the message here is really that all oral regimens should be scaled up as recommended by the WHO for these age groups, such as, for example, at the endTB regimen that Mylène will talk a bit after. So just a few acknowledgements here. All the patients, the endTB teams, all the national TB programs who have collaborated here, the central research team, the analysis team, and Cathy here, and Elena also, who is in the room, which were 7 years of great work with you, and all the endTB team in general. Thank you.